Welcome, everyone. As I said, this is Dr. Nushin Darvish. I am the Chief Medical Officer and founder of Holistique Medical Center. And today we are talking about the pain connection and the holistic approach to pain. And so I'd like to welcome you, Dr. Morella and Dr. Newell. Dr. Morella has been with us for almost 2.5, 3 years. And she's a primary care physician and acupuncturist and deals quite a bit with chronic disease, chronic pain, sports medicine, physical medicine. Does a lot of the IV therapies here. And we just love having her here. So that's Dr. Morella. She's also a licensed massage therapist, by the way, as well as a craniosacral therapist. So she's got quite a bag of goodies in her back pocket. Dr. Newell is joining us, I think, for the first time here on this platform. And Dr. Newell's been a doctor for almost 4 years, but he's been with us for about a year. He's a naturopathic physician. His specialty is sports medicine, physical medicine, spinal manipulation, injection therapies, Ozone therapies, IV therapies, and men's health. So without further ado, I'm going to welcome the two of you to take over.
Well, it's nice meeting all of you virtually. Thank you for joining us and taking time out of your day. But today's topic is holistic approaches to pain. So if we go down to slide 4, Dr. Merle. Just hopping into it right away, pain. So we can just break it down very simply into acute and chronic. So when people have acute pains, it's usually short-term, lasts days to weeks. Could be something like a sprained ankle or a pulled muscle, something along the lines where it's not too complicated. More along the lines of chronic conditions, though, it's pains that continue for 12 weeks or more. And these are examples of this are acute pains that don't get treated right away and can end up being chronic pain. So we see a lot of acute pains become chronic back pains, joint pains, nerve pains. We see headaches as well. And just doing the research for this presentation, I was reading that about 8 out of every 10 American adults experience chronic pain. And this is something that can be avoided. And today we're going to go into more detail over the next hour of how we can prevent acute pains becoming chronic pains.
Okay, so hi everyone. Again, it's so good to see and to see everyone. I wanted to highlight the naturopathic approach to pain, which I think is very different from the conventional view of pain. And that's just because we think of everything holistically, everything is connected. And we're able to do more in terms of pain. Before I go on, can I just ask that everyone puts their mic on mute just so we don't get any feedback? The button is on the bottom left where it says mute, or there's a mic or something like that. Okay, perfect. Thank you guys. So when it comes to diagnosis, obviously we're going to look at signs and symptoms. We're going to go through your medical history. Other things that we think about are referral patterns. So there's many different things that can cause referral pattern. One of them being organs. So like the classic symptom of a heart attack for specifically men can be radiating pain to their shoulder. There's also, with our gallbladder or our pancreas. So our gallbladder would refer to our shoulder, our pancreas straight to the back. So we're able to rule out if organ systems are being involved. We also think of trigger points, and trigger points are essentially when muscle fibers connect and they create kind of an epicenter of tension. And so that trigger point can cause a radiation of pain. So for example, our trapezius muscle, which is the muscle on our very top of our shoulders, that pain can radiate actually to our jaw, can also cause headaches on the side of our head as well. And then we also think of nerves as well. So one popular nerve that gets impinged is our sciatic nerve, which most people know that that causes radiating pain down the leg, down to the toes. Other things that we do are orthopedic exams, which I'm sure a lot of you guys have seen us do, which is to help us figure out where exactly the pain is and what tissue or connective tissue is involved. We also run labs, and I'll talk more in detail as to why labs play into a really good give us a good details of what's going on. And obviously we also can refer for imaging studies. And then when it comes to treatment, it's multifactorial, meaning that, you know, we're considering many different things. I think that oftentimes when you go into a conventional clinic and you say, I have back pain, a lot of the times they'll either just refer you or prescribe you NSAIDs, so like ibuprofen, or they'll give you a steroid shot, and then they say goodbye, and then they don't really address any other things. And then you just keep going back to the same doctor getting the shot, but you're really not addressing the root cause or other things that might be contributing to your pain. And so in this next slide, these are all things that we think of as naturopaths when we're thinking pain. Some of these things we've talked about in previous slides, and I'm going to go in a little bit of detail on some of them. So when we think of pain, we think of gut. So what's going on in your gut that might be causing some systemic inflammation, and I'll talk more about that. Alignment and biomechanics. So a lot of you guys have probably had some type of naturopathic manipulation, which is usually a high velocity adjustment from us, or we use the fun little activator, which makes the clicking sound. But basically making sure that your joints are aligned so that the biomechanics of that joint is optimum, right? And it's not creating any pain. We're also thinking of weight bearing, so how much weight is being put on that joint, and if and so you're getting bone on bone, which is also causing pain. We think of hormones, so, and I'll talk about this more, but our hormones, our levels of estrogen, progesterone, testosterone, that can also affect the laxity and stiffness of our joints, and thus if it's too lax or too stiff, then that can also cause pain. We think of infection, we think of our immune system. So do you have some type of autoimmune disease that's causing your body to attack your tissue, which is thus causing joint pain or muscle pain or body aches? And then we also think about inflammation. And I'll talk about all the contributing factors that we think of when we're trying to rule out inflammation. So the first thing that I'm going to talk about, though, is alignment and biomechanics.
Okay, so going one more slide, Dr. Marilla. So just going into the ergonomics, the average office worker spends about 1,700 hours per year in front of a computer screen. And if you do the math on that, that equates to about 70 days of mostly sitting at a desk. And when we sit for extended periods of time, it can result in several musculoskeletal disorders that most frequently affect the neck, the back, the shoulders. We also see a lot of low back complaints as well. Overall, this significantly impacts our health. So just going into what ergonomics is, it's just the process of arranging or designing furniture, products, systems in the workspace so that they fit the people that use them and minimize their risk of injury. And the goal of this is just pretty simple. It's just to create a comfortable space and productive workspace. And it helps to it's bringing together health and design in this very cool and unique way. Positioning and adjustments are based on all kinds of different things, but just the basics, body size, height. There is no one size fits all model for this. So everyone's a little bit different in what they need. There's some simple things you can do right off the bat with your chair. We want our feet lying flat on the floor and our knees at 90 degrees. We want our people or individuals that we want their back to be supported by the seat pan, and we want them to draw their shoulders back when they're sitting up. The communicator monitor needs to be about eye level or just slightly higher than the top of the monitor. And the goal is to limit the requirement of excessive neck use, which is going to lead to chronic pain and neck pain over time. And the screen should be about arm's length away. That's what the research has been showing. And it's simply with the keyboard, wrists should be in the neutral position. When they're in the neutral position, it prevents risk of carpal tunnel syndrome. And a little cushion pad is nice too. One of the things I've seen that is pretty cool in some office spaces and some tech spaces too, they have the riser desk, so it can go from seated to standing. And I think that's a good way of just reducing and minimizing your risk of injury over time. Next slide. Thank you. So going into a little bit what Dr. Merle was saying about the high velocity adjustments, there's something called osteopathic manipulation, or OMT. This is a great therapy for both acute and chronic conditions. It can be done manually with the use of a drop table, or sometimes with a little activator gun, as she was saying before. But basically what we're trying to achieve here is we're trying to realign the joints into a proper place. And this helps to alleviate pressure or tension on the spinal nerves, and overall helps to reduce pain. So when people come to see me, a typical visit looks like this. So I'm taking a detailed documented history. I want to know about any injuries, any surgeries, where they experience pain. I want to know about their ergonomics in the workplace, what they do for exercise, which we'll get into a little bit later. But basically, I want to thoroughly assess somebody and find out where their sources of pain are. For example, if someone's coming in with shoulder pain, that doesn't necessarily mean the pain is in the shoulder. That pain could actually be, the root cause of that pain could actually be in the mid-thoracics or upper back. So just getting down to the source of that. And then, I mean, our main goal and what to expect for this is just to improve overall sense of well-being. When we bring the joints into proper alignment, we're increasing the blood flow to those specific areas so nutrients can come and start healing that tissue in that area. And this also helps to promote relaxation and relieves tense muscles.
And then another thing that we think about when we think of alignment and biomechanics is fascia. So alignment of your bones are very important, but we also have to address the connective tissue around it. And the reason why is because your joints get pulled out of place because maybe your fascia, which I'll talk about in just a second, is tight, or your muscles are really tight, and so they're pulling that joint out of place. So we could continue to adjust you and adjust you and adjust you, but if those muscles and that connective tissue is not being addressed, then you're just going to get out of alignment every week, which is one of the reasons why chiropractors end up seeing their patients quite frequently, is because they're readjusting them maybe once or twice a week. And there's other things that we need to address in terms of addressing pain and long-lasting relief. And so one thing that I like to talk about is fascia, which is the connective tissue around the muscle. The way that I think about that is your sock. So your sock that goes around your foot, and maybe if you're wearing a high sock, your ankles, but the sock is your fascia. And so the difference between fascia and muscle is, when we think of muscle, we think of an action. A muscle can have many different actions, but they essentially insert and they attach at a certain area, creating different actions or maybe one action. And so we think of that muscle moving around a certain point or fulcrum. When we think of fascia, we think of movement as an entire unit. And so if you look at the picture on the right, you can see that the blue lines, they are showing myofascial lines. So there's superficial lines, functional lines, lateral lines, spiral lines. And some of you have actually worked with myself or Dr. Rohde and Tiffany. And Tiffany works a lot with these different myofascial lines. And the way that we think about things is, if one end of your body is tight, or you're experiencing pain on one end of your body, then we also need to release the other end of the fascial line, because everything is connected. And another way to describe this is, if, let's just say, a table is your muscle, and then the tablecloth is your fascia. If Dr. Newell and I are sitting on different ends of the table, if I pull on one end of the tablecloth, he will feel that pull on the other end. And maybe he'll get mad at me because he's trying to eat or something, but that's essentially what's going on. And you want that tablecloth or that connective tissue to slide. And when that doesn't slide, it creates pain. And the reason why it creates pain is because there are pain receptors within the fascia. So a lot of people want to say like, oh, it's the muscle that's causing all these pain. But really research is showing that the nociceptors, so the pain receptors, are actually within the fascia, and it's breaking up those fascial adhesions, addressing those myofascial lines that helps with fascial sliding and shear and relieving that pain. And so this is one of the reasons why acupuncture is somewhat or is really effective. And so acupuncture works on meridians, which are basically the same as these myofascial lines. There's acupuncture points that start all the way from your head, or channels that start all the way from your head and go all the way down to your feet. And essentially what the needles are doing are working on the fascia. So Western philosophy thinks of fascial planes. In this picture on the left, here I'm doing some cupping. And so this is why cupping is so effective. It's using suction to lift the fascia around the muscles, and it's breaking up those adhesions. So there's different ways that you can do it. You can flash cup, you can run the cups, and that would help kind of break up those fascial adhesions, or you can leave them stationary, just like shown in the picture. Then the other technique is surround the dragon. So in this particular patient, the pain was in that lateral or side of the elbow. And so I'm pointing all of the needles around that area so that it brings chi, so our vital force, and blood into that area to cause healing or to help healing. The next thing that we want to talk about or consider in pain is inflammation. And so there are different factors that cause inflammation in the body, but these are just a few that we think about. So diabetes, are your sugars high? Gout, is your uric acid levels high that's causing pain in your joints and in your first toe? Do you have high cholesterol? And do you have any autoimmune conditions that could be attacking your tissues and your joints and thus causing pain? And the reason why we think of inflammation, this is going to be particular to the next slide that I'm going to show, which is one of the treatments that we do here, which you guys may or may have not received. And that treatment is PRP, aka liquid gold. And so PRP stands for platelet-rich plasma. And so our platelets, when we think of biology, they're recruited to help with vascular lesions, so to help with wound healing, because they cause coagulation. They essentially cause a clot to kind of close up that wound. And so they're finding that the platelets contain growth factors and cytokines to help with inflammation, stem cell proliferation, and cell proliferation. And this is why it's super helpful in treating musculoskeletal injuries, scars, wrinkles, which some of you guys may have received Dr. Darvish's PRP facelift. It can also be helpful in alopecia, dental procedures, as well as surgeries. And the reason why I'm bringing up inflammation in this is because essentially what we do for PRP is draw your blood, we spin it down, and we take the part that has the most platelets in it, which is usually like the second portion of it, which is gold, or it looks gold, aka liquid gold. But essentially, if you have any of these things that are going on, so high sugar, high uric acid, high cholesterol, an autoimmune condition that's maybe uncontrolled, we don't want to use your inflamed blood and use that and put it in an inflamed area. It may or may not really help the pain, and it might help it for a little bit, but you might have to come in more frequently. It might actually cause a flare. So naturopathically, we want to think of, okay, let's get everything handled. Let's bring down the inflammation. Let's prep you for this procedure so that you can get really great effects, right? And this is what I think sets us apart from other orthopedic doctors or other doctors that are doing these types of procedures, because they might not be looking at all that, right? They might not be looking at what's going on in your body. Do you have any inflammation going on, and how to address that? So the next thing that we think about is hormones. So how are your hormones playing into pain? So your levels, like I said in the beginning of this presentation, your levels of progesterone, estrogen, and testosterone can affect the laxity of your connective tissues and tendons. So if your connective tissue and tendons are a little more flexible, that's going to change the way the joint moves, and thus it can cause pain depending on the biomechanics of that joint. And in this study, they looked at women who had already had an ACL rupture, and they looked at how they are jumping and landing and the biomechanics, and also the knee laxity as they're doing jumps and landing. And they found that there's an increased risk of re-injury of that ACL before ovulation. So when estrogen and progesterone are at their lowest. And that was because there was more knee laxity, so that ACL is a little more flexible, which changes the way your tibia is rotated, as well as your hip. And so that will affect the way you land. And they also found that women, when they're on their period, they land harder. And so what this shows is that, you know, women can be affected differently depending on where they are in their cycle. They might be a little more flexible, they might be a little more stiff. And so we have to be cognizant of what's going on hormonally in order to address pain and biomechanics of a certain joint. And this is generally why men are less flexible than women, because they don't have as much estrogen and progesterone as us females do. And then the next thing that we also address is also infection, which some of you guys may have experience with some of our treatments here in terms of these infections. But bacteria, fungi, parasites, viruses, these can all live in our joints and cause joint pain. And in this particular study, they found that Mycoplasma pneumonia, which is a bacteria that is normally lives in like our respiratory tract, they found that when you have an infection from Mycoplasma pneumonia, it can increase your risk of getting rheumatoid arthritis. And another bacteria that can live in your joint is Lyme, so Borrelia. And so this can cause what we call Lyme arthritis, and this can obviously also cause joint pain. And so here we can address certain therapies to address your infection and make sure these bugs are killed so that it will alleviate your pain or joint pain. Last thing, which we talked about last week, is your gut. So I'm hoping that you guys are seeing that there are so many different ways that we can treat pain. And it's not just, you know, thinking of the physical things. So like joints and muscles and fascia, you know, it's a lot of different things. And so gut, which we talked about last week when we talked about our microbiome being off, it can cause leaky gut. And so when we do have leaky gut, which means that the tight junctions within our intestinal wall are now bigger than they normally are, which then lets bacteria, parasites, and inflammatory markers like cytokines and prostaglandins escape and circulate in the blood. Well, these can also get into the joints and also cause pain and inflammation. And so we would address what's going on in your gut, like, is your microbiome healthy? Are you eating the right foods? Do you have any food intolerances like nightshades or milk or dairy that might be causing some inflammation and joint pain?
Okay, so we're gonna dive into some treatment options here. One more slide, Dr. Marla.
Oh.
Thank you.
Yeah.
So as you guys all may know, one of the most important ways to improve overall health and to manage pain is actually through exercise. It helps to increase strength, muscle strength, and increase joint flexibility. And this results in reduced joint pain and stiffness. Also, we get the release of endorphins when we exercise, which has been shown in many studies to actually reduce pain levels as well. So some good exercises right off the bat, but please discuss with your doctor before you begin any exercise program just to make sure it's right for you. Some great ones right off the bat: walking, swimming, water aerobics, another great one that actually is low impact on the joint, especially if you are experiencing chronic joint pains. Pilates, yoga, strength training, Tai Chi. And there's a plethora of other ones, and especially now more than ever, I know some gyms are closed around the United States right now, wherever you're listening from. Just do what you can. If you gotta get outside, go for a walk, do that. I strongly recommend that. Even if you have limited mobility, small exercises you can do while lying or standing, or lying or seated, just to move. Movement is key. I always emphasize movement with my patients. It's very important, vital to our lives. When we limit movement, it actually weakens our muscles, affects our posture, leads to poor posture, which leads to chronic upper back pain, chronic neck pain, and just cascades into further problems. Next slide.
May I add something, Dr. Newell?
Yeah, go ahead.
I think another thing to think about too with exercise is that yes, it is good for us, but it's also not good when you do it in bad form. So I think I try to tell people, I want you to strength train, I want you to squat, I want you to do body weight exercises, but sometimes these exercises can cause even more pain, especially when you're doing it in horrible form. And so if you are experiencing pain when you're doing certain exercises, it's important that you bring that up to your doctor so that they can address maybe your form and or give you different exercises to do so that you're not causing more pain and or injury. And so working within your range of motion that doesn't cause pain is the general recommendation. But yeah, form, I'm a big stickler for form.
No, I 100% agree. And just kind of going back on the exercise, this sparked something in my mind. When we had people come in and they get osteopathic or kind of an adjustment manipulation, as we call it, we also will prescribe exercises because we want these exercises to be able to, we want to be able to hold that alignment. And when our biomechanics and alignment are off, we have a tendency to slip out of alignment pretty easily. So we want to strengthen those muscles in that area as well. Next, yeah, there we go. Perfect. So going into some mindfulness and some meditation or any kind of mind-body technique, really. I guess going over the overall basics, we have our nervous system can be broken up into our sympathetic nervous system and our parasympathetic nervous system. Our sympathetic nervous system is when we get that adrenaline rush, that adrenaline release. It's when we're running from a bear. It's our flight or flight responses, as we call it in medical school. But when we practice mindfulness and meditation or any kind of mind-body technique, we want to slip into the parasympathetic nervous system because this is actually where healing occurs. It helps to reduce muscle tension, helps to decrease pain levels, different techniques like just breathing or progressive relaxation, guided imagery, whatever the mind-body technique may be. This helps to improve overall mood. It's been shown in many studies to actually help decrease chronic pain and other acute pains as well. Also helps decrease stress levels and anxiety. So just a great overall, something you can incorporate, take 5-10 minutes out of your day, at beginning of the day, end of the day, middle of the day, wherever it may be. But it's just a great thing to do for pain. Yeah, hopping into some of the nutraceuticals and herbal stuff here. One thing I do want to mention before hopping into this subject is make sure you consult your doctor before starting any kind of nutraceutical or herbal supplement because they can interfere with your medications, and we want to make sure that there's no adverse effects with that. So before beginning any of this, please come speak to one of us, talk to your doctor, whoever it may be. So the first one we're going to hop into is Boswellia, just an absolute great herbal supplement here. The active components of this herb actually have anti-inflammatory and pain-relieving properties. And it's been shown in a multitude of studies to significantly improve osteoarthritic pain or any kind of joint pain or chronic pain. Another study showed it actually slowed cartilage deterioration and damage over time. Going into capsaicin, the active component in chili peppers. This helps to temporarily reduce substance P. And substance P is just a chemical that's released by our bodies whenever we undergo a acute or chronic pain event. And so it's a pain transmitter. And there's been many studies that have shown that this helps to reduce joint pain just after 3 weeks of use. So pretty awesome herbal supplement. Turmeric or curcumin is the active ingredient in turmeric that actually helps to reduce joint pain and swelling. There's been some clinical trials out that have shown that people taking this tend to have better long-term improvements in their joint pains. Cat's claw, also another great herbal supplement. Great anti-inflammatory properties with this herbal supplement. Contains compounds that actually even benefit the immune system, so you're kind of hitting multiple fronts at once. Fish oil contains omega-3s. GLA is omega-6 oil, but has been shown extensively actually been used in many inflammatory conditions to be very great and help to reduce that inflammation. It helps to significantly reduce joint tenderness and stiffness in RA patients as well. Next slide. One more. Thank you.
Mm-hmm.
So just contrast hydrotherapy is something very easy you can do at home. Works to relieve pain, stiffness, inflammation, whatever it may be that you're going through. But it's basically as contrast indicates, it's the alteration of hot and cold water. And the reason why I like this is because it's feasible, it's safe, it's effective in any kind of injury recovery, really. And it's cheap, which is great. But basically what our intention of doing contrast hydrotherapy is we're trying to force our tissues to adjust to extreme temperatures. And what this does is help to stimulate our metabolic and circulatory activity, which breaking that down even more is we're bringing, when we use the heat, we're actually dilating, increasing blood flow to that area so we can get nutrients in. And then when we cool or put our feet in cold water, we're restricting blood flow to that area, and it's almost like this pulsating effect of bringing nutrients in and inflammatory cytokines out. Great, I love it. Basically, how you do it, just take 3 minutes. So you get hot bucket and cold bucket. So you want to do 3 minutes of our, whether it's ankle pain, we want to do 3 minutes of the ankle in the hot water, followed by 30 seconds of the cold water, and we want to repeat this 3 times. One thing I do want to mention, and I've seen this happen before, and I've actually done it on myself, is be careful when you're using the hot water. We want to do it as much as you can tolerate, but we don't want to burn you or the skin or create further injury. Okay, going into some ozone here, it's pretty awesome stuff. I had the privilege of going to an ozone conference earlier this year and learning from one of the greats, and I'm pretty blessed to be able to do that. But basically, bottom, most beginner level is like, what is prolozone? So what are we doing? So we're injecting protein or some kind of glucose or nutrients into the joint space. And you may say, why would you want to do something like that? But it's actually incredible what the research is showing. It helps to treat pain, it helps to regenerate damaged tissue. When we inject the ozone, which is just oxygen with an extra oxygen molecule, so it's O3. And when we inject ozone into the joint, it helps to stimulate circulation in that area, helps to increase oxygen utilization, stimulates cytokines, and it helps to, it has antimicrobial effects too, so it actually kills viruses and bacteria. And the reason why this is important is when you inject ozone or a nutrient into a joint spaces and joints in general typically have low blood flow to that area. And it can take years, months, weeks, whatever it may be, to actually for that joint to heal. But within a couple treatments, and especially with the patients I've been working on with this recently, you see incredibly unique and just regenerative properties like within 3 to 5 treatments. So it's absolutely incredible. decreasing their pain levels, increasing the healing process. So when my patients come in, typically they ask, like, what should I expect? What should I feel? First thing right off the bat, decreased pain. So especially people with chronic pain issues, this is great. And you're going to start to see some hard and soft tissue regeneration. You see chronic injuries, degenerative processes stop and actually start to reverse. About 75% of chronic pain sufferers who undergo this type of therapy become permanently pain-free. Absolutely incredible treatment. You can even use, as Dr. Morella was talking about earlier, the PRP within the Ozone as well, and just stimulating those growth factors in that area, just further benefiting and helping to regenerate that tissue. So absolutely just incredible therapy. I'm pretty excited that I'm able to use it here at this clinic, and I've seen some great things already happening with it. So that's it for that. I could talk about that all day, but I'll spare you unless you come see me.
Thank you so much, Dr. Morella and Dr. Newell. So if anybody has any questions, you're welcome to either unmute yourself and ask it, or send a chat note and we'll be happy to answer. I do want to add to this presentation, this great presentation, that pain is a very subjective issue. In other words, people have, there's been studies done where they've looked at the backs of people and who are suffering with pain, and they find that those with horrendous looking herniated discs have actually no back pain, and those who have nothing going on in the back may have severe back pain. So it can be a very subjective issue. A lot of the pain is caused, like Dr. Morella said, by the fascia, in a sense, being inflamed and squeezed. Remember that fascia is like that tablecloth. And so one of the things that throws that off is scar tissue. If you have scar tissue in an area, let's say first injury when you were 10-year-old and you sprained your ankle, that scar tissue from that ankle could actually later on cause pain somewhere else in your jaw, in your neck, in your shoulder, in your back, and somewhere else. And so it is very important for us to also look at scar tissue and do some techniques such as neural therapy, which kind of reset the nervous system and break down that scar tissue and help the movement of the fascia, so that when we do body work, then it's a lot easier to mobilize that fascia. So I just want to add my 2 cents to this wonderful presentation. Thank you, guys.
Yeah. Does anyone have any questions? I do want to add that I've noticed that just for myself in terms of pain, I get more pain because I've been sitting on my butt watching a lot of Netflix. And so I do want to just say that I'm hoping that you guys are feeling somewhat encouraged and motivated to move. Mobilizing your joints, maybe doing some stretching, walking, just doing whatever you can to move helps, because as we talked about with ergonomics, when we're sitting for long durations of time in horrible posture, it causes more pain and actually more stress on our joints, more so than like lifting in a bad form, really. I see that there's a question, but my mouse is not working. So
yeah, I think the question.
The first one is neural therapy different than prolozotherapy? Either one of you want to take that, or should I answer?
I could take it. I'll explain it a little bit, but if you want to hop into the neural therapy aspect a little bit more. Yes, they're two completely different therapies. With Ozone therapy, we're actually going into joint spaces. Typically with neural therapy, we do use procaine as well, and that's more of a surface, like a sub-Q treatment over the skin. But yes, two completely different therapies. You can do ozone with neural therapy too. I don't know if you want to dive into that a little bit more, Dr. Darvish.
I can actually. So ozone is they're working on two different mechanisms. So ozone is, as you guys might know, it's 3 oxygen molecules, and Dr. Newell had talked about it, which is it's helping oxidizing the tissue, helping with blood circulation, and so that's why it helps with regenerating damaged tissue. And with neural therapy, we're not using ozone, we're using procaine, usually 1% procaine. Sometimes we can mix it in with, you know, different nutrients, like Dr. Newell said, which maybe some sodium bicarb, which some of you might know takes the sting off. And some people put like B12 and folic acid. And essentially what that is to supply nutrients for the mitochondria, which is our ATP, or it basically helps us make energy. And so it helps with healing if you have more energy. But essentially what procaine is doing, it's traditionally used as an anesthetic. And so it is helping with pain because it's numbing. But the reason why is because it's blocking those P receptors, so your pain receptors, so you're not feeling that pain. But also, depending on your technique, if you are using it to break up that scar tissue, it helps with breaking up those adhesions so that now the fascia can slide. Also, another thing that it's doing is resetting the nervous system so that your brain can now not associate that with pain, if that makes sense. It just helps kind of reset that area, bringing circulation, bringing qi in a Eastern medicine perspective into that area to cause or to stimulate healing. Do you have anything to add, Dr. Darvish?
No, that was great. The fact that a lot of times both of them we use together in conjunction, and oftentimes we use neural therapy to kind of open the pathway for the ozone treatment, which allows it to work better. So we use some of these treatments in conjunction. Do you have another question in regard to a complex injury that happened with ribs getting injured and broken and kidneys being lost and so forth? And this individual has tried neural therapy with good success. I do want to say that on top of neural therapy and prolozone, in this case, it is also important to look at the emotional aspect of pain. Emotions can play a huge role in the way we manifest pain. And these emotions can come from childhood trauma. They can come from generations back. And it's almost like a memory that repeats itself when we're exposed to a situation that may subconsciously remind us of a trauma that happened in childhood or a trauma that happened to our grandmother. And these are all been memorized in our system. So it is important for us to look at the emotional component of, for instance, an accident, an injury that happens, because that shock that goes into the system along with the injury needs to be unlinked at a nervous system level and at an emotional level. And it takes more than just neural therapy and prolozone therapy and pain medication and so forth to get that cleared up. The other treatment that we often use is IV therapy. So IV nutrients play a huge role with giving the body the nutrients it needs directly to balance out those pain neurotransmitters, as well as allow the body to get the building blocks it needs directly to the tissue to heal itself. So there's a lot of different aspects that we need to look at when it comes to chronic pain, and address it from a very multifactorial space rather than just let's kill the pain. And in the meantime, the underlying processes continue to find another avenue to show their face. I think that answers those few questions. One of the questions I'm not understanding says, what is there a remedy for neural therapy? I'm not sure what that's, or neuropathy maybe, neuropathy. So who would like to take that question? Any natural remedies for neuropathy?
Oh, I was thinking homeopathic remedy, and I was like, I don't remember my homeopathy that well.
Right off the bat, one thing that comes to mind is B12. Great for neuropathy.
Yeah.
It also depends on the type of neuropathy too. Like the source is the source of neuropathy is important when you're factoring or trying to think about remedies. But B12 is something that comes to mind right away.
So B12 is great, and often because the nerve sheath can become deficient in B12, and that nerve sheath protects the nerve. And when the nerve is kind of unclothed, I want to think of it as that sheath being not there, and the nerve is naked, that can cause more neuropathy. So the B12 is a nutrient that allows that sheath to build up. But there are other nutrients as well. Alpha lipoic acid is a huge one. Alpha lipoic acid is something that we do intravenously. Orally, for some of these conditions, it may not be enough. And so oftentimes we dose it intravenously a couple of times a week, sometimes even 3 times a week for a few weeks to get that level up in order to act as an antioxidant and as a healer to the nervous system. It works great for many types of neuropathy, including diabetic neuropathy and neuropathy from injuries and whatever the neuropathy may be caused by. But keep in mind that neuropathy is also an impingement of the nerve, which means that we again have to go back to what Dr. Newell was saying, is look at the structure, and what Dr. Morella was saying, look at the fascia to see if anything's impinging that nerve. And fascia runs around everything. It runs around organs, it runs around nerves, it runs around muscle. So it runs around everything. And when that fascia is inflamed, you can also get neuropathy. So we have to look at multiple things here.
And also diet as well too. Like you might be having neuropathy because you have high blood sugar. And so those are things that us as doctors have to rule out. Like what is going on? Is it a vitamin or mineral deficiency? Is it a joint thing, or is it a nerve impingement? Is it high blood sugar? And so we would have to explore those things, and there's not like a one size fits all. And I think that's the fun part of being a doctor and being specifically a naturopath, which is we get to incorporate all these different things and investigate, and we don't just give up on you,
And one other infection that I always think of is the tick-borne infections. Babesia is one that causes a lot of neuropathy, and it's more common than we think, but people who have traveling neuropathy can have babesiosis, which is an infection that we would have to address that sits in the nervous system. Obviously, disc issues that are damaged or impinged structurally, we need to address that. And Prolozone is a great way actually to help heal the disc as well as in conjunction with neurotherapy. And hydration. Don't forget hydration, guys. Hydration is really potent treatment for pain. Got to drink up that water and hydrate.
Looks like we've got another question here for the contrast hydrotherapy, whether or not we use ice water or just cold water. I tend to have people use ice water if they can, but if they don't have access to ice, just nice cold water works just as well too.
I usually say whatever you can tolerate. Not many people can do ice water. I, for instance, can't do, I probably could, if someone wants to compete with me, but I generally don't like to tell people to put themselves in too much discomfort. So cold is just as cold as you can tolerate it. And so again, it's 3 minutes warm and 30 seconds cold for 3 cycles. And so it's something that you want to do every day. I used it actually when I rolled my ankle. I've rolled my ankles many times. It's pretty helpful for sprained ankles.
One other suggestion or comment I want to make is that when there is chronic pain and nothing else is working, we need to look at the hidden infections. Mm-hmm. And oftentimes those hidden infections are in the jawbone. And so that's where we need to look for chronic pain that's not resolving. What is going on in your jawbone that the dentists are not picking up and nobody else is picking it up? And often that can be the pull on the fascia, basically, that's aggravating the nerves and the fascia and causing pain, maybe in your joints, maybe in your back, but it's really coming from your teeth. So I think that wraps it up for us for this afternoon. Thank you, everybody, for joining us. Next week at noon, we will be discussing hormones and the impact of hormones on our well-being. So please join us at noon, and we'll be sending out the link early next week. Look forward to seeing all of you next week. Thank you so much. Bye-bye.
Thank you. Bye.